Good day, guys. And you guys are welcome to our YouTube channel. You are welcome to a new video that we are making on the accessory nerve injury. Okay, we spoke about the accessory nerve, and right now we'll be talking about the injury to this nerve. Right, that's the accessory nerve palsy. This is the MBBS Nigeria. You guys are welcome to this YouTube channel. If you haven't subscribed to our YouTube channel, kindly do subscribe, like our videos, and share our videos. All right. So, moving on to the next, we'll be talking about the accessory nerve injury. Right. Literally, you could just get to know that this is the injury to the accessory nerve. Right. It's the accessory nerve disorder is an injury to the spinal accessory nerve, right? It results in the diminished or the absent function of the sternomastoid muscle and the upper portion of the trapezius muscle. Okay, so this is just for you to know that whenever a nerve is affected, whenever a nerve is affected, the muscles which this nerve supplies actually suffer. Okay, let's just put it like that. The muscles in which this nerve supplies are actually diminish in function. Okay, and you could actually get to see that these muscles, because they are not being used, they reduce in size. All right. For your muscles to maintain their size, you must be using them. So, what are the signs and symptoms, right? What will you actually get to see that you get to infer that there's an accessory nerve injury or accessory nerve palsy? Okay, so patients with a spinal accessory nerve palsy often exhibit signs of lower motor neuron disease, such as diminished muscle mass, right? Fasciculation, partial paralysis of the sternomastoid muscle, right? Here there's paralysis of sternomastoid and trapezius muscles, right? Interruption of the nerve supply to the sternomastoid muscle results in an asymmetric neckline, while weakness of the trapezius muscle can produce a drooping shoulder, winged scapula, and a weakness of the forward elevation of the shoulder. Right. You can see that. Just take a look at. I think let's go across. So let's go again on the signs and symptoms again. You can see that patients with spinal accessory nerve paralysis often exhibit signs of lower motor neuron disease, such as diminished muscle mass and fasciculation, and the partial paralysis of the sternomastoid and trapezius muscles. Right. Interruption of the nerve supply to the sternomastoid muscle results in an asymmetric neckline, while weakness of the trapezius muscle can produce a drooping shoulder, a winged scapula, and a weakness of the elevation of the shoulder. Because the elevation of the shoulder, right, control of your scapula, all are brought by the sternomastoid muscles and the trapezius muscles. All right, and these muscles are innervated by the accessory nerve. So a paralysis of the accessory nerve will affect these muscles. All right. So moving ahead, you see this is a picture showing your sternomastoid, showing your trapezius muscle, and we are moving. All right. So what are the causes of the accessory nerve? You could see that medical procedures could cause the accessory nerve palsy, all right, during surgery and so on. So let's read through. Right. Medical procedures are the most common causes of injuries of the spinal accessory nerve. In particular, radical neck dissection and the cervical lymph node biopsy are among the most common surgical procedures that result in a spinal accessory nerve damage, right? London notes that a failure to rapidly identify spinal accessory nerve damage may exacerbate the problem as early intervention leads to improved outcomes, right? So you actually get to detect this fast, right? We spoke about the causes. I got to see that it's mostly surgeries or radical neck surgeries and the cervical lymph node biopsy. So if you want to actually know that the accessory nerve is affected, how will you go about this, right? The function of the spinal accessory nerve is measured in the neurological examination. How the examination is administered varies by the practitioner, but it frequently involves three components, all right? You inspect, you check the range of motion, you test, all right? And you test the strength, all right, of the muscles. Okay. During inspection, the examiner observes the sternomastoid and the trapezius muscles, looking for signs of lower motor neuron disease such as muscle atrophy and the fasciculation. A winged scapula may also be suggestive of the abnormal spinal accessory nerve function as described below. All right, so you could see the drooping of the shoulder. This is drooping of the shoulder, and how to control the drooping of the shoulder. You actually use this belt, right? In accessing the range of motion, the examiner observes while the patient tilts and rotates the head, shrug both shoulders, and abducts both arms. A winged scapula due to spinal accessory nerve damage may often be exaggerated on arm abduction. Okay, so strength testing is similar to range of motion testing, all right? Except that the patient performs the action against the examiner's resistance, all right? So if you want the patient to like raise his shoulder, you can and lightly press his shoulder with your hands and see how this patient is actually going against your resistance. Okay, so the examiner measures the sternocleidomastoid function by asking the patient to turn his or her head against resistance. Simultaneously, the examiner observes the action of the contralateral sternocleidomastoid muscle. For example, if the patient turns his or her head to the right and the left sternocleidomastoid muscle normally will tighten. Okay, you ask the patient to turn his head to the right, to the left, and so on. So, treatment of the accessory nerve palsy. All right, so there are several options of treatment when iatrogenic, when it is caused by a surgeon. Okay, it's caused by a surgery procedure, right? The spinal accessory nerve damage is noted during surgery. For example, during a functional neck dissection that injures the spinal accessory nerve, it prompts the surgeon to cautiously preserve branches of C2, C3, C4 spinal nerves that provide supplemental innervation to the trapezius muscles. And alternatively, in addition to the operative procedures, post-operative procedures can also help in recovering the function of a damaged spinal accessory nerve. For example, the Eden-Lange procedure, in which remaining functional shoulder muscles are surgically repositioned, may be useful for treating trapezius muscle palsy. Okay, guys, I think this is like a winged scapula. The first image, as image A, is showing that the patient is actually rotating his head, but the sternocleidomastoid muscles are not getting tightened. Okay, guys, so with this, we have come to the end of our video on the accessory nerve injury. If you haven't subscribed to our YouTube channel, kindly subscribe to our YouTube channel to get access to more and more videos that will be coming in. This is the MBBS Niger. All right, like our videos and comments on our videos, share our videos to your study partners and your classmates. Okay, so see you guys in the next tutorial. Bye for now.